Welcome to White Coat Black Sheep, where science gets curious and dogma gets uncomfortable. I'm Dr. Civelli, and today I have Tim Pace with me. We're going to talk about physiology, evidence, and real world medicine, plus all the questions you're not supposed to ask, but probably should.
Ooh,
If you care about health and think there's a better way, welcome to our show. Thank you
absolutely.
so much for coming on
No, thanks for
today.
having me. It's great to be here.
I am just so excited to have you because there's been so much time that's passed since we were working in Bakersfield, seeing our elderly, sweet patients.
They're lovely.
They're so
Such a
lovely.
joy.
And they think we're
No,
so
they don't.
young because they're just really much older.
They are. I feel so old, and they think I'm so young, and I'm just like,
We're young pups to them.
sometimes I'm dying inside. But
Mm.
there's a few lively ones out there. I got to say, I had a dancer this morning.
Really?
Yeah, you don't see that very often. I think she
A
was
male? Oh,
96.
female.
Yeah, she was like cruising down the hallway, ready for dance class.
I wonder what
So.
her lifestyle was.
Got to be something amazing. She's got, she
Or
probably has some
maybe she's
secrets
like,
that she doesn't want to share.
right?
I think it's movement. Movement is the key.
She's dancing. She's still
She's a
dancing.
mover and groover. Yeah, absolutely.
Man, I think that's definitely the
It's
answer.
got to be.
Well, okay, so you are a doctoral candidate for 2027 and
Yes.
you're almost through your first semester. How's it going? Tell us,
Oh,
what is a doctorate of lifestyle medicine?
so
I
lifestyle
love it already.
medicine is, basically whenever you look at it, there's six pillars, right? So you've got adequate nutrition, you've got avoiding risky substances, restorative sleep, um, maintaining physical activity, and my two favorite ones are stress management
Oh,
and social connectedness.
oh my gosh.
So those are the ones, and so when you look at this from the outside, it's like these are the things you're supposed to be doing that people already know
Yeah.
about. They're like, wow, why is that a field of medicine? But
Yeah.
certainly it goes way deeper
Because
because
we're not good at it, people. That's why.
exactly people don't do it.
Look at me. I
And
rolled in
yeah,
so stressed.
yes,
I had to
yes.
like deep breathe.
Mhm.
Literally before we started this session, you saw it and you're like, you're good. I feel stressed.
Yes, and it's the hardest thing to implement these things.
It
And
is.
so, from a lifestyle medicine standpoint, you interview people, you listen to them. There's
Yeah.
these long forms that you fill out that you don't see on a regular medical intake, and you find out where people are on their human connection side.
Wow.
Where are they at, physically, but also mentally? What kind of barriers do they have in their life? And then you start to address those. You got to find out what stage people are at. Do they want to change? Are they like, oh no, I'm not changing. I'm not here. Are they at this, pre-contemplation stage, or are
Yeah.
they motivated and they're
Mhm.
at a further stage? And so you actually give them it's non-medical prescriptions for activities to do. They're called fit prescriptions,
I love
FITT, so frequency, intensity, time and that these are the things to help people move through the stages to ultimately make this a lifestyle, a habit.
it.
And it's harder than you think. I mean, really.
No, it is so hard. And I don't know really what's more challenging right now. Because
Yeah.
to like be successful, to be fit, to have the look that you want, to have the
Mhm.
life that you want, to I don't know, the family, the vacations. I mean, come on.
Yes. So it's like it's these small changes that you make. You're not flooding somebody with.
Thank
You're
you.
not just somebody's like, I want to get into exercise, and you're like, I'm going to prescribe you a marathon a week or whatever. You got to examine what their
I
lifestyle
would fail.
allows. And so it's interesting when you first come in as a patient, you do this lifestyle medicine long form, and it's asking you all these questions about how you perceive things, and then you score it. And the biggest like surprise for me when I did it and went back and reviewed it is I found out I had anxiety. I scored off the charts on anxiety and
Yeah, you
stress.
mentioned that.
Yes, I knew I was stressed, right? You're like, oh, life is stressful. It's
It's
this and
so
this. But I
hard
never considered anxiety as a thing. And
because
those
that's the diagnosis. That
absolutely, yeah.
changes it.
And it's just how you perceive a certain situation, like how you feel about it, and then
You just gave
it's
me an
there.
anxiety breath. Did you see that? I just got anxiety for you. Oh my
Yes, yes, but,
gosh.
it's I think the first step is recognizing it, right?
Ew.
Then you can address the things and,
I'm ignoring mine.
Oh, yes, yeah,
I'm not ready.
well, it's really difficult because, the stats are astounding how many people are so stressed out
Yeah,
over work, social media, life in general, responsibilities, and it builds up. And then,
yeah,
as you know, there's these, detrimental effects, like
yeah,
physically,
yeah.
chemically in your body from stress.
Predictably.
Right, right.
Predictable health
Yeah.
problems.
So you got to find some interventions there before it gets out of hand and leads to like psychosis or depression or
I don't want
like,
that. I don't want the
yes,
other one either.
or total burnout.
I don't want
Like,
that
oh
one.
yeah, yeah, because we've experienced burnout before.
Oh
There's
my
nothing
gosh.
that is worse than just sitting there thinking there's nothing I want to do, and then you just isolate, right? You're just like, I don't
Yeah,
want to hear anybody, I don't want to hear anything, and then you just crawl in a corner.
yeah. And then nothing happens for you in that
Exactly.
corner. You
No,
just are
no, no, you're just hiding from everything,
existing in
you
this
know,
corner.
which, taking your time, it can be great, but you want to do it in a healthy way, right?
No change has happened while you're in the corner.
No, no, you just put off all your problems, let them build up. So, yeah, yeah, it's very interesting, and it's cool to see little techniques that you can throw in here and there that can make a big difference.
I love it. Well, I do hope that throughout our entire session that you do throw some of those little techniques.
I'm going to teach you a very easy one,
Please.
and so when you're ready, we can do
Mhm. Okay. So before we learn how to fix anything,
it.
you acknowledge that I have anxiety, right? Because you did I guess, a questionnaire.
Yes.
So there's been a lot of different talks, even especially about like depression, about how we poorly diagnose it and how we are using these old school techniques to treat it with like SSRIs or whatever. But really, we don't have any other tools. It is a subjective assessment, but look at what it did for you, right?
Yes, absolutely.
Like questions that request you as the person taking that to look inside, stop what you're doing, and to just read, do I actually have this? It's weird. It's a different experience.
It is, and that's one of the big rules of the American College of Lifestyle Medicine. They really hold their providers to living the lifestyle.
That's the phase I'm
And
in. So I
and
guess I'm,
yes, yes. So
yeah.
I mean, it's just like, going to your physician and them preaching to you about losing weight if they're overweight, or them preaching to you about stress if they're like a total stress ball. And it's like, you got to live the life. And
Yeah.
for me, I think it's been a huge therapy session
Yeah.
going through.
I love that for you.
Absolutely.
So it's
Absolutely.
fun.
I'm not gonna say school's fun because they there's a
They're not always
significant
fun, I
amount of
guess.
writing.
Oh,
I think
yeah.
for people who love writing, that might be super fun for them. I'm more of a talker, as you know, just like just get it flowing, and we'll sit there and talk forever. I hate texting. I hate
Yeah.
any form of written communication. So it is,
Interesting.
and this is a lot of writing, and
Are your thumbs slow? You think maybe that's part of it? Or as a guy, maybe your thumbs are big?
thumbs are
Show
slow.
me your thumbs.
I think I have average thumbs, but it is basically I get around it. Like if I'm
Mhm.
writing a paper, I have it on dictate mode,
Yeah.
and I'll just sit there and talk about the whole thing and write the paper, and then go back and fix all
Into
that.
like Microsoft Word?
Yes.
Okay.
Yeah.
Whenever I was in my paper writing era, that feature didn't work. And so it was like your voice text gone really wrong. Like it just is so bad. I'm just like, you are a useless feature.
It is, I think it's gotten better. I mean,
Good.
it does a decent job, and,
You're lucky.
yes, yes,
Yeah.
there's room for improvement though, because it'll still put some weird things in there.
Still sucks.
You can't just let it fly without proofreading it, that's for sure. You could definitely go down a little wrong road there.
Oh
So,
my gosh. Well, okay, are we any steps like closer to the farm? Because I know that's on the list of the future, like wellness
yes, yes.
ventures.
So that's the mission. As you well know, I've ventured out to Idaho looking around for this perfect farm for the miniature donkeys and alpacas and all the fuzzy little
Which are gonna
things.
I love it.
Yeah,
There is
yeah.
such therapeutic, like, Intervention, I think that would
Exactly.
work for me.
Yeah, yeah, and
Or
it's
like
much
fluffy,
easier.
innocent, sweet, can't talk.
Absolutely. That's the key there, can't talk. I mean, you just come home to your animals, they just love to see you, they run to the fence, they're super happy,
Yeah.
which interestingly enough, like, talk about that, like, biochemically for us, for humans, and for dogs even, they did a study on the release of oxytocin by petting your dog, and the
Oh,
release of oxytocin in the dog itself coming up and freaking out. Theirs is way higher, they're way happier than we
oh
are,
my
to
gosh.
so they
That's
just
why we're
get
so
that.
bonded.
Yeah, that's the thing. Little
We are,
Jax,
'cause
like, it
yeah.
comes in and just loses it,
It's like,
when
I
you
just
go.
made him high.
Yes, exactly. So it's really cool to
Dang.
learn. You think of it as just, oh, it's an emotion, just being happy, but it's actually, you break it down, the science. It's a chemical process that
Yeah.
you're dealing with
Just gave him
there. I mean,
drugs.
all of these things are what, no matter what the emotion you're feeling, there's a process going on chemically in your brain that's doing it.
Do
So.
they talk about cats, like, why they just, like, don't care?
I haven't got to the cat part, but I just I would love to
They're like,
know, their level
they're like a
of
head nod.
yes,
Sup?
yes, exactly, yeah, or they just look at you in disgust and walk right by, maybe slap something off the counter, but that's their way of showing you it's either a big F you or it's like, or
That's
it's
just
just, but
savage.
you know how they'll just look at you sometimes and they know
Judgy
they want you to
eyes.
make eye contact, and then they just stare at you and slap something off of the counter. I know Leo, a cat was like that, and she just would knew she wouldn't do it, but she would just boom and just wait for you to react.
Oh my gosh, if
That's
we have any veterinarians or anybody in this, like,
oh,
industry of, like, science, if you happen to know the chemical differences, I would love to know.
yes.
Okay, so just fun fact, while I took Jax to his cardiologist because I mean, I think he was faking a heart issue just for attention, for more oxytocin, because he was fine, but I learned that dogs are more parasympathetic, so their heart rates are slower, and they have a natural, AFib. So, I
Really?
'cause I heard it and I was like, "Oh my gosh, this sounds irregular," but then technically you're not
Yeah.
supposed to be able to hear, you know, atrial fib.
Mhm.
So
Yeah,
I'm
yeah.
like, "Okay, I just knew, like, this is a murmur." So and then it was irregular. So, yeah, and then cats, on the other hand, stay, sympathetic.
Okay.
So, like, just in their heart rates are different, like, a normal for cats is different than normal for dogs.
Yes,
Anyway,
yes. I don't know. I mean,
yeah.
like we were talking about, there's all of these nervous actions, the release of
Yeah.
the chemicals, everything you do. So when you're stressed out, you're stuck in this sympathetic
Yeah.
pathway.
Yeah.
You're in fight or flight,
Yes.
essentially. Even when
Yes.
you think of a scenario. So this is things that we run into with. So maybe I'm not judging gender wise, but I've heard many times that people wake up mad out of dreams. And I've been the recipient of somebody being mad at me because of a dream.
I know
And so,
people who have I've never
so
I don't say I okay, I probably shouldn't say I never anything, but I don't think I've ever done that.
yes, well, it's fairly common. It's happened to
What
me
has
multiple
happened?
times. And so these dreams, I obviously do something wrong. Somebody wakes up and is very mad at me, and then I'm have to suffer the
It's not
consequences and
your guilt.
apologize for what, whatever Dream Tim did, so it's
Dream Tim.
exactly, exactly. It's like nightmare, however you want to put it. But the same is true. So when you're thinking of a scenario in
Mhm.
your head, and it may not be true at all. Say you're running a scenario, you're gonna confront somebody or say something. I mean, that elicits that chemical release of stress and sympathetic activity and
Yeah,
oxidative stress in the body,
yeah,
just thinking of the scenario. The scenario doesn't even have to happen.
right. But it's like a neural link was formed, like, there's a circuit that was formed.
Yes,
Why do we have to remember
absolutely.
it? That part makes it weird to me.
Mhm. Yeah.
But I guess it's also because it surged a catecholamine or even, like, an like, an anticholinergic, like, surge. Both of those any of those could cause a memory,
Absolutely. Yeah.
which is
Yeah.
crazy.
Yeah. And yeah, it's all when people say it's all in your head, it's there.
It is
It's there. There's so
physically,
much
chemically.
control. I mean, you think about these Buddhist monks that sit there and meditate, and people are
Are they
just
really happy?
so
Have we
well.
asked
I
them?
think it's about like being present, being in control,
So they don't even ask that
controlling your
question.
memories, controlling your thoughts to your advantage, to, not being at the mercy
I'm
of
a
the wild
victim.
brain. The wild brain's out, somebody's got to tame it. Somebody get a whip.
I'm a straight victim.
Oh, right here too. I mean, this thing goes 90 miles an hour. Wake up in the middle of the night and it's like beep, 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 beep. It starts firing off all these stressful
Oh my
things. I'm like,
gosh.
ooh, let me put on some ancient aliens real quick and kind of distract myself. So
So then that's your okay. So on that note, so then you do recognize it. You feel like a little bit of a surge, a spiral in a sense,
absolutely.
overwhelm, anxiety, and it's like you know that you need to go back to sleep health wise and that
Mhm.
you can catch another window. So you put on something to like the higher center of you, like your frontal lobe then chooses that.
Yes. Yes.
So that's
And
the
so,
cool
mhm.
part.
So you've got to make these decisions, right?
Yeah,
Otherwise, you'll lay there inside your head and start going around in circles. And
which
here,
is a
here
loop.
it's a loop. And then you're laying there, and then you're starting to fear
Mhm.
out of your, let's say, is it the prefrontal cortex or the amygdala? The
Mhm.
amygdala, your fear
Amygdala
center.
center.
Yes, yeah. So you start fearing that you're not going to go to sleep and
Mhm.
that you're going to be tired the next
Yeah.
day, and then
S-
you elicits
Sleep
anger.
stress.
Yes,
Yeah.
you're angry because you can't go to sleep, and then your heart rate's up, and then you're,
Yeah.
oh man. So
Yeah.
there's ways around that. I mean, obviously, and probably you've heard of it, like Calm app, things like that. They've got that.
Calm did not make me feel calm.
I got a funny story about Calm. So I signed up,
It
and
made me
they
mad
had
that it made
they
me feel uncalm.
it was they have you tried the bedtime stories? Um
Wait, does it have a purple cover?
I don't know. It's
I don't
on the
know.
app, but I had
Interesting.
never tried a bedtime story. So there was this one. I just picked a random one, and it happened to be like Harry Styles telling a bedtime story.
He has
And
a he has
he's
an
like,
accent.
imagine us cuddled underneath the stars. So here I am cuddling with Harry Styles underneath the stars.
Were you
I
smiling?
was
Did you
like,
sort of like it?
I laughed. I was like, what?
You laugh because you like no.
It was no, it was just this is so random, and I think Matthew McConaughey has one.
Oh, wow.
There's different Hollywood stars that have started putting out these
Interesting.
bedtime stories.
Huh. Based
Yeah,
on the voice that you want.
I mean, it's their voice. Yeah, yeah. I
Huh.
mean, I think a good person that could do it would be Morgan Freeman. He does a really good one. I could listen to him. Like, yeah, I think he like reads the Bible or some book, or I could just listen to him. He's
I
just
think
got a very
it's the
calming
bass
aspect.
in his voice.
Yeah, it must be.
He's
Must
got
be.
a very deep voice.
Mhm.
I think most people would like that.
Yes,
Very
yes.
manly.
Yeah, my favorite is David Attenborough. He
I'll have to look up who that
narrates
is.
these a British guy that narrates all these nature things, and he'll tell you
Oh,
random facts about animals. Just random. I
I
mean, the
love
weirdest animals,
random
and just
animal
the facts
facts.
about them and what their behaviors are. And
Yeah,
then it bounces to another animal. And so there's no storyline that you get caught up in. You're just listening to his voice tell you facts about animals. And that, I mean, for
I
me,
like
that's
that.
great. Then you
Yeah,
don't have to worry about the TV, even though Ancient
yeah,
Aliens works good. I think the blue light from the TVs disrupts your sleep
I
patterns
know.
and your REM sleep. So
And I
that's
choose all like okay, not me, but like, Crystal choose all these like murder type shows. And I'm like, oh,
yes.
the violent Jack's my dog. He can't even like handle it. He hears a
Oh
few
man.
like one gunshot, he's out.
Oh
He's
no.
like, this is ruining my sleep score.
That's my mom does that. My mom listens to the ID channel and like serial killer type stuff to sleep. I
I just
incorporate
don't get it.
that in my dream, so it's a little
Okay.
weird. I'd rather dream about like random little animals doing their thing.
I love that.
Yeah.
Or even like in real life, not sleep or like going to sleep to this stuff. I like just random animal facts. I find it
Yeah.
calming, interesting, always relevant to
Mhm.
no matter what is the situation.
Yes.
It's like
Yes.
therapeutic.
Right.
So
Right.
you guys just like if you're around us, just hey, did you know?
Yeah. Just like just like random facts about the galaxy, space, anything like that. And I
Yeah.
think everybody has to find their calming thing, right?
Yeah.
Like I'm very interested in space and alien stuff. I hope to get
Yeah.
abducted one day, and that is, I listen these things that don't have a storyline because you start listening to a storyline. If I'm listening to an interesting book,
Yeah.
I'm just going to get into it. So there's little tricks to sleep, but there's also
Yeah.
breathing exercises that are
Oh, I
really
need to
good.
breathe better. No, I agree with you. It's
Yeah,
just so effective, but it's easy to disconnect and forget that part.
absolutely, it is. And that's where you have to integrate see what people's situations like. If you've got
Yeah.
a high stress job, you know, you're already behind all the time. There's things coming up.
That's
You
how I
got to
feel.
find quick little interventions,
I need
and
quick
and
interventions.
so one of the easiest things
Yes.
is
Let's hear
called
it.
box breathing. Have
Okay.
you ever heard of that?
So when I did my first cold plunge, the guy was like, "You should box breathe."
Yes.
And I was like, I was just flooded because the cold plunge is just so cold.
Yeah.
So no. I guess the answer is no.
Okay. All right. So easy thing. So what you do, I mean, you don't have to close your eyes and do this. It helps me to do this.
Okay.
And so you visualize this box, okay? And visualize something going around the box. So like you inhale for 4 seconds and then you hold it for 4 seconds. Then you exhale for 4 seconds, hold it for 4 seconds, and repeat. So that's a 4, 4, 4, 4,
Okay.
right?
And you're
And
drawing
so
a box.
you're just drawing that box. You're just watching the little thing go around the box. And there's
Interesting.
actually videos online
Like a
doing that.
Pac-Man.
So that's the easiest one. And then you can do that. I mean, less than a minute. I mean, you can do one round, you can do 10 rounds, however much you need to calm yourself down. And so I've got a little list here of all the benefits of box breathing. What's
Please
going to
no.
happen?
Let's hear
So
it.
so obviously you're doing this deep breathing, so you're going
Hmm.
to increase your oxygen level. You're going to decrease your blood pressure. You're going to increase your parasympathetic, which is the relaxing. You're going to decrease your fight or flight because say you're stressed out, you're getting to a point, somebody's made you mad, you're starting to do this. So you got to
Hmm.
shut that off,
Like you
okay?
feel the flood. You feel like a flood of, oops, you
Yes.
feel
Mhm.
all
Yeah,
those
you
feelings.
feel this going on, and so it increases your GABA, which is your calming chemical, decreases your cortisol, which is
Okay.
your that very detrimental stress chemical,
Yeah.
right? And then decrease the adrenaline and
Hmm.
noradrenaline. So
Okay.
therefore, you're from the adrenal, so you're decreasing your heart rate and your blood pressure. You're activating your prefrontal cortex,
Okay.
which increases focus and
Mm.
helps with decision making, clear decision
Oh,
making.
thank God.
Okay.
I
All
needed
right.
to hear that.
And then lastly, you're calming down your amygdala, which we talked about earlier, is your fear center.
Which sucks, just on that note, that
Mhm.
your amygdala is a lower function. It is a lower level of function. When I learned that in neurology, I was just like, oh my God. That's why they're like emotional decisions. They are not wise decisions.
Exactly.
They're not.
Exactly.
They could
So,
not be.
yeah, because when you're stressed out, you're not going to make the most rational decision.
Mm-hmm.
You're not going to think through it clearly because here you are, this adrenaline's flowing. All this is you're
Mm-hmm.
going to be reactive.
Yeah.
Your blood pressure's up.
Yeah.
Calm thinking, decisive. And so it's
Prefrontal.
interesting that just doing this box breathing a couple times around less than a minute, and
Mm-hmm.
you can feel the psychological high that you get from it. You can
Wow.
feel it, right?
Yeah.
And it will recenter you. And it's such a easy little thing. There's tons of techniques, there's tons of breathing and breath work out there, but that is I found the easiest one to explain. It's
That's
not
awesome.
complex, and people can implement that at a red light.
Oh my
You
gosh.
getting some road rage? Do some box breathing for a second.
Totally.
I just did it on the way here. So,
Oh my gosh. So when it comes to if you compare that to like say the
Mhm.
the out breath
Yes,
specifically will lower the heart rate.
yes,
The difference with box breathing is giving that like a fair and equal like square, right?
yes, yes.
So it's like you're
Mhm.
giving energy to like the parasympathetic to balance on the seesaw with the sympathetic
Right, right.
because they're always in competition.
And the thing, a lot of the times, the tool that's in there is also the focus. So we were talking about distracting ourselves to go to sleep, right?
Yes.
So you're not thinking about these things you got to do the next day
Yeah.
or what's stressing you out. So by focusing, and the reason I said visualize this box in
Yeah.
your head is
No, that
because
helps me
there
a
you go.
lot.
Now your focus has changed
Yeah.
totally off of the thing that was causing you to get all raged up,
Oh
you
my
know?
gosh.
So, I
So
mean, it's
many
very,
things.
and there's tons of techniques. I mean, you could
Yeah.
go into breathing exercises and breath work for a long time, and it's just, it's great. And once
Yeah.
you put that into practice and can
Mhm.
implement that in your daily, that's just a little tool that you have in your pocket.
I'll just stop
Yeah.
talking to patients. Like
Yes.
I'll have a stressful patient. I'll just like, hold on.
Yeah.
I am seeing a box at this.
Or let them keep talking because 'cause they're probably not talking about
I just
anything
won't close
relevant
my
to the
eyes.
visit. So
I'll draw a box around their head.
we've talked about this before, how it's just like you're in a visit with a patient, and the last thing they're talking about is the relevant things. They're talking about their cousin or where they lived 30
Why?
years ago, and you're like, "You're wasting both of our
Oh,
times right now. Let's
you
get this thing
guys.
done." Not that you don't like chatting it up with somebody, but you have an appointment, you have a certain length. Let's address the problem and work on
Yeah.
it here, not fly off the handle and talk about such irrelevant things. Yeah.
Yeah. If I could give any piece of like advice to non-medical people. No, I don't even want to say that because I mean, even like outside of, so you're a physician assistant, you're going for your doctorate, clinical for 20 something years, right? In
Right.
orthopedic surgery. And then MP, MD, DO, doesn't matter. We have to document a certain way. And there's no way that patients will, I mean, you won't know how we have to like gather the information and put it in so that it's proper. But we have to, at some
Yes.
point, gather specific details and put them in an exact format that is medically proper and legal and medical and useful. And if we don't do that, then it's like we just wasted, I don't know. You're at risk of
Yeah.
so many things, like
Yeah.
medical, legal.
Absolutely.
And so, whenever you as a patient don't give us anything that is relevant to like this is your moment. There's no other time. This is the time for you to say exactly what you want, feel, how you are doing, how you're not doing. The rest of it doesn't fit into our note. It doesn't help us. It just maybe I get to know you a little bit better, but you are wasting your time.
Absolutely. Yeah.
It's just so I don't even know how else to say it.
Right, right. I mean, if you have extra time, I'll,
Who
you know
was
me, I'm
that?
a talker. I'll chat with anybody. But when you're on 20-minute time slots or 15-minute time slots,
That's not even real anymore.
yeah, I know.
You know, I'm
You have
trained.
that much of documentation, right?
Mine was so I don't know about yours, but we were trained to do a 7-minute start to finish.
That
Your
was,
note, everything. That
yes,
means 2 to 3 minutes with the patient and then next orders, next do your note and then sign.
yes.
Like we're drilled timed
Hmm.
and these are formal.
That's crazy.
That
It's
means like don't tell me 31 years ago when I was in Oklahoma and I
Then you're distracted.
woo,
My uncle, he lived there, and he did this.
I
So
d
it's like that's fine.
I
Like,
died.
yeah, yeah.
That's I can't. It
Catch
shuts
me
all of us
outside
down.
and conversate with me. Just don't do it here in the office. Like, yeah,
I gotta
see
get
me.
to the bottom of
Yeah, see me at the
you.
grocery store. Then we can, chat. But yeah, don't waste the office time doing that.
Yeah. And I don't know about how you handle these, but whenever somebody like tries to throw the ball back to me, because we walk in, we're the provider. Hey, how are you? Great. How are you? I'm wonderful. How can I help you? Oh, what's new with you? Nope. 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 Irrelevant.
Yes. Yeah.
We are both here for
Yeah,
you.
this is my new. This is what we do right now. This is what's new. So let's get back
Yeah.
on it, right?
What's new with you? I'm gonna always bounce it back, and I just don't I just wish that somebody had, like, maybe, like, a pre-visit video.
It's not a bad deal. Yeah, yeah, you just do that. Or you have like one of those big red buttons where you just hit it and it's like focus, focus. Just hit it. So you don't feel like you're interrupting somebody, but if you hit the button, I think they'll get the point
Yeah,
after
would
a
you
little
guys think it's rude if we throw up, like, flags or cut like you were in a yellow zone? You were in the irrelevant zone headed towards, like, a red zone where it's like,
Yes, yes,
and
we're doing that. It's not to be rude, it's to
mm-mm.
get you the most out of your visit,
I
right?
can't help you if
Yes,
you just spent your entire time and I've just given you, like, the best of my energy, and the last person gets scraps.
yes.
Especially, like, when you go home, that person really gets scrapped.
Oh, exactly, exactly. Well, that medical professionals are burned out. Burning
Mhm.
out is a huge thing. There's so many articles on it right now.
Yeah.
The percentage is going up, 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 along with documentation and EMRs
Ugh.
and social media, all of these things, and people in general in life, the anxiety, the depression, the stress levels. I mean, they skyrocketed after the internet, and especially if they were on a trajectory like this after the internet, then after COVID, they were like this. I mean,
Oh,
there was a
totally.
grand change in society, and so it's a huge medical problem. I mean,
Yeah.
it's a psychological and physically medical problem because, as we talked about, the psychological effects affect your physical,
Ugh.
your cardiac,
It does. We
your
can't
metabolic
separate it.
disease, and, just the going back to the basics
Yeah.
with lifestyle
Yeah.
and getting things in order can prevent, up to 80% of chronic and metabolic diseases
Wow.
if you can
I
just
believe it.
follow this.
Yeah.
And it's really interesting.
In your doctorate, do they focus on more of, like, the provider side to not burn out or the patient side or both? Like,
It's
of bringing that together?
It's really focused on both. I mean,
That's good.
I've never been in, like, throughout any of my medical training, throughout whatever, it's all been about the patient.
Yeah.
And then you're automatically supposed to be okay
We're
as a
the asset.
provider, right? Yeah, we are the tool.
Yeah.
You're just supposed to be okay. But then, as you know, I've seen it myself. I
Oh,
mean, we take the
yeah.
least care of ourselves, people around me. It's not just me, but I've been like,
No, we've
chugging Mountain
trashed
Dews and
ours.
eating Snicker bars at 3 o'clock in the morning trying to get to the next
And we
surgery.
laugh about
And
it. I used to
yeah,
smash Red
yeah.
Bulls, like 3 of them, and be like, "I don't
Yes.
feel anything."
Yeah, it's just pots of coffee. I mean, just all the things that are horrible for you, and then you're trying to give your energy to
Disgusting.
other people, so you can't be your best as a provider if you're not taking care of yourself. So it's very unique that this program focuses, and there's things. It's like here's a provider section. You're taking a survey, or you're taking the same thing a patient is on the monthly to see where you're at. Because if you're down here, how are
Yeah.
you going to get somebody up here? How are you going to
Oh,
lift
I
them up?
love that.
Yes, absolutely.
Ooh, that's really good.
Yeah, so
It's almost like the other side to the comment that we hear over and over and over. Maybe we've even said, like, who wants to see the doctor that is, like, not the image of health and wealth, right? Like, who wants to be the patient of somebody who's like, you need to exercise and work on your diet and stress, but then they look very unwell. They look
yes.
very unhealthy.
Yeah.
They look sloppy and not put together. And it's like uh, they're giving too much to you.
Yes, yeah.
To somebody, they
Mhm.
have given too much and they need to look at themselves now.
Absolutely.
And so it's like on our side, obviously, like we're in this industry, so we're preventing from ever getting to that point. But I could see how easily it could
Oh, yeah.
happen.
I was
And
down
we,
that road.
yeah,
I
same.
I entered burnout. That's
I
just
same.
I just finally burnt out and just took off.
Yeah.
But luckily, I had that luxury to do that. I'd kinda squirreled away and just took off for
Squirrel.
months away, months at a time, isolated, random countries, and
Well,
just
you were also in the
walked around.
surgical, like,
Yes.
I mean, what's
Lots of
worse?
surgery.
What's what's a less kind, soft place than surgery? Like a surgical OR.
Yeah,
Oh my
yeah,
God.
yeah. But at least you don't have to worry about what you're wearing because you have your surgical scrubs,
That's true.
and they may be wadded. I don't think they look very wrinkled, like they were just wadded, and you
Yeah.
just walk around looking like that all day,
Like a
just
slob
grumpy and
because
just
it's
there
sterile.
might be blood stains
Ugh.
on your pants that you don't realize that are there, and you're just walking around with a piece of somebody's knee stuck to the your pants. That's just life, right?
Well, from a non-OR perspective, but family medicine, I remember like my first inpatient rotation, I saw my senior and she was wearing the surgical scrubs and I was like, "Why are you in surgical scrubs?" And she had like she looked awful, like kind of like I don't know, like she just worked out or something, you know?
Yeah.
And how that look is. And so she also had like this like dry, this is so bad. She had like some dry stuff, like it was kind of cracked on her neck.
Uh-huh.
And I was like, "What are you coming from?" And she's like, "Oh, I just had to deliver a baby, and, oh god, that's amniotic fluid."
Oh,
And
yeah.
I was
Yeah.
like, I mean, I knew the family medicine had to do OB-GYN, but, like, you get splattered by amniotic fluid, and then you don't even shower, and then you're still wearing this there's just so much.
Yeah, yeah.
Like, we can do better, but, like, when? Because, like, she didn't even eat, she was exhausted.
Yeah, you never know when this stuff is on you.
You
Sometimes
know how
a pretty big surprise, you know? It's
The
like
shocking was, like, if I'm wearing my glasses, right? I don't know about
mm,
I mean, you're wearing, like, the whole outfit, but
yeah, in total joints, but,
yeah,
trauma, you typically don't wear the spacesuits, but when you're in,
yeah.
total joints, yeah,
The
it's
splatter
there's a
usually
lot
came
of
from
power
them.
tools going on there, so the high RPM power tools, there's stuff everywhere, yeah,
Oh my
which is it's really the fun part of it,
Yeah,
right? When you break out these saws and the drills, I mean, that makes you feel like you're doing something.
it really
Yeah,
does.
it does.
I did 1 OR day for ortho,
Yeah.
and I was like, "Pass me the drill." So they let me do, like, some hammering, which, I mean, I
Yeah.
wasn't strong enough for any of that stuff, but
Oh, it would come with time. You can stick
yeah.
it out. I'm sure you can make it happen. Put the
Oh my
rage into it. It's a
gosh.
very, it's very
Oh,
therapeutic, right?
it really is, it is.
It's basically woodworking.
Yeah,
You are woodworking. You're using all the same tools and
yeah.
just making it happen. Yeah.
So, post hip replacements, arthroplasties, it's like, "Oh, you're having pain? Well, that honey, that's normal.
The-
Have you seen what happens
I'm
with
surprised you're not in more pain, right? Yes.
drills?" Yeah,
Yeah, it's pretty
totally
amazing what the human body can endure.
a little achy,
Yes,
babe.
yes, exactly, exactly. So,
Normal.
but people are resilient when they want to be. But once again, it goes back to your mindset.
Mhm.
If you know you're going to do well and you're motivated after
Yeah,
surgery, you're going to do well. If
yeah,
you go into it like, oh, this is going to be horrible, and no, I don't want to do therapy. No, 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 it's going to hurt. Well, you're probably not going to do so well.
yeah.
You're going to stiffen up.
Harvard has done a study that was actually pretty, like, I don't know, it was, like, a little much even for, like, other Harvard professors. They were, like, judging the person that did it, like, "That's a little extreme," because these people were wearing, like, whole bodysuits, so even, like, if they passed gas, that would be, like, equated for.
Yes.
So everything in and out was equated for. And so, anyway, that was actually, I need
Wow.
to find the name of that study.
Yeah,
I wanna just bring
that
it to
would
the
be very
table.
interesting.
Yeah,
There's a study for almost everything out there.
there is.
I mean, people are looking for reasons to do a study.
Well, okay, so they're looking for reasons to do studies, but also we need the
We need that.
information
Yes,
and we need
absolutely.
also people to better understand the studies. So, like yesterday, for example, I had a study given to me and I was just talking about progesterone with somebody and they screenshot something from Mayo Clinic. Love it. Mayo's a great source to cite. But the way that they put together the information of what we were talking about, not correct. So people
Yeah.
make leaps because, I mean, we still speak in a different language than what we did prior to all of this training.
Yes.
So being able to read all the studies, understand them, and then apply them into useful ways that you can get a medical relevant, I don't know, you have to make it
You're
relevant.
deciphering it. I mean, you've
Yeah.
got to take this accurate information and then you could take a
Turn it
study
to
and you can
action.
turn it to bias. So you have
Yeah.
to be very careful. You may go
Yes.
in with a preconceived idea and look for things in there that
Yeah.
are trying to prove your point, even
Yes.
though the study is not.
Yeah.
And so that's a one big thing when you're writing. You got to
Yeah.
decipher and write it correctly.
Yeah.
And so that's podcasting as we're
Mhm.
doing or YouTube or posts.
Yeah.
Those are ways that we can get this information out to the public. But
Yeah.
you can see it a lot where
Yeah.
people have taken these and kind of construed it's almost like the media,
Yeah.
right? They're just like, I'm gonna spin my own little storyline here. I'm gonna take
Yeah.
a piece of this, and I'm gonna glue it together, and then this is gonna be the truth.
Yeah.
So that's really a risky thing when you're listening to people who may not be have the integrity to not be biased. Right.
Right. Like, I at least hope to always, always, always. So, yes, like right now, we control the message, right? We're
Right.
talking into this microphone. You guys are all watching, and you are hearing what you hear, and we're controlling the message. But I hope to always just, give exactly my interpretation of information. Look it up yourself. I would love to just create conversation.
Absolutely.
And if I'm wrong, then I want to be corrected.
Yes.
So I'm
Totally.
not afraid of being wrong. I'm not afraid of saying, "Oh, you know what? I did say that." And oops, thank you for telling me.
Right.
Like I
Right.
I want to be corrected. I want to do
And
better.
there's a lot of stuff that's available for access too for people who
Yeah.
want to do their own research. There are
Yeah.
libraries out there. There's free access. There's paid access.
Yeah.
There's research AI now that
Mhm.
makes it so much easier, right? So they'll go. You can give it an idea, and it's going to bring up all these articles that relate, rather than having to go.
Wow,
I
that
know
was
my
me in
life.
old
Yeah, the
school.
library old school was like, you
Oh
better
my
search exactly
gosh.
what's in the title or
Yeah.
in the abstract, or it's not gonna pop up. So consensus
Man.
is nice.
And I mean, as somebody who has written a lot of papers and published several,
Yes,
your title is actually the most important. And sometimes, like a title is very long
it
with
is.
the intention to get snags like that.
Yes, exactly.
And the more specific, like a 14-year-old female with coccygeal meningitis to the brainstem, basal ganglia. I mean, you can really just make it very, very specific,
Absolutely.
and I mean, that's how I would name my papers.
That's You're one of those writers, are you? You just love writing.
I don't love it, but it was a tool,
Yes, yes.
and I
I mean,
think
it's definitely worth the work. I mean, you
yeah,
do learn a lot by going through this, even though it can be painful with the busy work on top of life.
painful.
But
Yeah,
that's what we grind for. If it was easy, everybody would have one.
that
Everybody would do
is
it.
true.
Everybody.
Okay, so for your lifestyle, tips, is there anything like that you would recommend? Like that's so we know like our box breathing, we have
Mhm.
that. We know like why it would be helpful or
Yes.
redirecting with when you're trying to fall asleep or if you are asleep then you wake up, how do
Yeah.
you bring yourself back into sleep?
Really, it's about recentering. I think the breathing is there, but you have to. Everybody's different, so you have to find your avenue.
Mhm.
If you could do it by meditation, that's the cleanest way, right?
Yeah.
Turning the TV on, which is what I've done all my life, and I'm trying to wean off of it. But Ancient Aliens makes me at peace.
But
It
can't you
works, but
listen to it?
I do. I listen to it. If I look at the screen, it doesn't work. So I just listen to it. So listening to something, that's the easiest thing. Just don't do anything with a storyline. I would say
That's
if you
true.
can there's a reason they say practice yoga and practice meditation. And if you've ever done yoga, yoga's hard.
It's
That's why
really
you
hard.
practice. Has somebody mastered yoga? There might be a yoga master out there, but you practice at yoga because
Mhm.
you can continue to get better. Meditation is even further.
Yeah.
I mean, these people that center on meditation, monks or whoever, they
Yeah.
work at it all their life trying to reach the pinnacle eh, of their control
You know
and
what?
exist.
I used to think that was so abstract. I think the closest thing I can really bring that into a more like tangible form, like for board exams or tests or anything that like you have to get through. It's hard to sit down and like an 8-hour test or I had a 8-hour test for 2 days. So to train yourself to you're going to sit here ignore the world around you and just focus on this one question. Next question. I mean,
Exactly.
w-
Living in the moment
yeah,
without distractions.
nothing else. So but to go back to that way of thinking is just it's different.
It is. It is, and
And
it's hard, and people are like,
yeah.
"Oh, you get it." I get people all the time, "Meditation, oh, do that,
It
whatever."
feels so
It's the
intangible.
word. I mean,
It's
it's
like
hard.
this
It's not
thing. Do
bad
you
when you
see
do
it?
it, but it is difficult to shut down and just live in the present second, the nanosecond, and be
Yeah.
entirely focused. So it's something you definitely have to practice with. So, you got your sleep. I mean, nutrition, you can, all the
Oh,
evidence is
nutrition.
just pointed to
Huge.
whole food, plant-based. And so before anybody loses it, like, it's not vegetarian, it's not pescatarian. People are like, "I'm not giving up my meat." I'm like, "Nobody said you had to." I'm just saying plant-based, right?
Yeah.
And then all the bros that are like, "I'm getting my protein." I'm like, "Where do you think that cow came from? You think it's out there eating steak? No, no, it's eating plants." There's tons of plants with
That's true.
very high amount of protein in there.
Mhm.
And my favorite thing is vegetable medley. I go over, I've got Trader Joe's across the street. I go over there, I pick out random vegetables,
Mhm.
throw them in a pot, put some of that protein beef broth on there, and I boil it, and there are my meals for the week.
Does it feel like it tastes good?
It
You
tastes
feel
good.
good?
Yeah,
Yeah.
absolutely. Yeah, yeah. So I feel good. It's ready. It's
Mhm.
cheap.
Yeah.
Seriously, and it's good for you. And
Yeah.
then I still want to go out or go out to dinner. I'll have a steak or whatever.
Yeah,
I
so
just
it's like a
not
sometimes, not a
Yeah,
always.
exactly,
Yeah.
because my old way was I have to have meat with every dinner, right?
Hypercholesterolemia was your old way.
Yes, it was, and I said, it, you've seen my lab, so it was like triglycerides were up, cholesterol was up, and
Yeah.
even though no matter how healthy I thought I was living, I was still just intaking
Yeah.
all this. So if you can just base it that way, there's tons of things, lentils, soy, any of these beans, they've got protein in it. You
Yeah.
can still
Meet your
beef up.
quota.
Yes, yes.
Yeah. I mean, you haven't lost muscle mass, so I think
A little bit, but, I've,
have you? I mean, I
yes,
haven't
yeah.
seen you from, like, maybe 2 months.
Yeah, yeah, I haven't been hit it that hard. I've been sitting at a computer with my face in it writing
Doctoral
scholarly
life.
papers,
Oh, I love
but
this.
certainly you can do it. There's a good video out there if you ever watch it called Game Changers. It's, about these pro athletes and, the strongest man in the world who are on
Mhm.
plant-based diets.
Yeah.
And so there's things to do with that. So you're hitting your sleep, you're hitting this. But one of my favorite, and then I know we're running short on time, is I just want to touch on is connectivity,
Okay.
social connection. That is
Ew, who would
so
have
important.
thought?
Yes, because in this stressful environment,
Yeah.
you're not sleeping good, you don't feel good. A lot of people just isolate. They go
Yeah.
through breakup or stress at work. They just want to isolate and
Yeah.
just shut down, right?
Yeah.
But social connection is so important too. And as we were talking about with your animals increasing that oxytocin, you get that by having good
Yeah.
connection, not just being around random people.
Uh-huh.
Maybe it is that for you, but actually connecting with the people. And a lot of people have the social anxiety or have problems making friends and connections. There is an effort to it. It's a challenging
Oh, that I
pillar,
like that you said
right?
that. Yeah.
So you have to, and sometimes people have isolated themselves over
Like,
time.
wave at your neighbor.
Right,
Say
right.
hello to people walking
Small
by.
moves, right?
Small.
Right, yeah. And if you're in California, they probably won't say hey back and just look at you weird. But that's but that's okay. You
It's
just
just
get
like
used to
now
that
our
here,
norm.
right? Yeah. It
Yeah.
used to be so strange coming from the Southeast. I'm like, why are these people don't say hey back when I pass them? But
That's why people probably think we're so nice because
exactly.
that's just how people do it in Florida.
Yeah.
"Hey,
Yes.
how are you?" Don't actually tell me.
Yeah, don't tell me. We're just trying to be
We're just
polite, right?
kidding. Yeah.
And, yeah, but I tell people, if you want to get that connection, try to find what you're interested in. It doesn't matter what it is. Find what you're interested in. Find other people that are interested in that. We have such an advantage. The internet and social media can be such a disadvantage because you can get lost and go down this rabbit hole of whatever your algorithm takes you to.
Yeah.
But you do have groups like Meetup or whatever that it's other people out there who feel equally like they want to connect with
Awkward
other people, but
and
it's awkward.
isolated.
And they're
Yeah.
just like, there's Bumble BFF where you go meet friends.
Stop.
Yes, yeah, where you're
Oh
just
my
like, I just want
gosh.
to meet a friend because, and as a medical traveler, I get it. Sometimes you're in a city, zero people. I'm just like, I just want to hang out with somebody, or I want to go, play
Yeah.
tennis or go snowboarding. I wish I had somebody to go with, and so you can get on these groups and
Yeah.
actually meet people that are interested in doing the same things you can. So there's options, but you got to take it in baby steps because it's not that easy. There's a lot of mental block.
Yeah,
behind it,
so
right?
okay, so to lifestyle, you have to make small changes in your overall lifestyle. Thank you so much for those tips. I look forward to hearing more. I
Yes, yes.
love experiencing your journey with you as you are on this path. It is so, I want to go into that doctorate too.
You'll be getting the monthly updates for
Okay,
sure. Yeah, yeah, you'll
amazing.
get the newsletter.
All right, Tim Pace, thank you so
Thank you
much.
for having me. Great to
Pace of
talk with you
life.
guys.
We'll
Absolutely.
talk again soon.
Absolutely.
Thank you, thank you.
Yes, yes.
All
See
right,
you soon.
and that is all.
Thanks,
Until
guys.
next time.